appreciate the comments from my colleague from Colorado. I don't think it's unique to the states out west, be it Oregon or Colorado or California or Idaho or Nevada and so forth. I think people in every single state care about access to health care. Now, I came to the Senate in 2009, and in that year, we decided to make a major effort to fill in huge holes in our health care system. Well, we had Medicaid for the least affluent, but then folks who were just above that, they couldn't afford private insurance. They also didn't qualify for Medicaid, so we created extended Medicaid and made it a state option. And that covered a lot more people. And then when you came to the middle class, you had folks who had insurance through their employer, but not every employer provided insurance. And so we created the health care exchange, where you could buy insurance and you could do so with tax credits to help you make the payments so that they were affordable. Well, that plan was pretty straightforward, but a man named Frank Luntz, he was a pollster and message maker for the Republicans. He put out a memo, and I was one of the first members of the Senate to see this memo. It was April 2009, and the memo said, whatever the Democrats come up with to improve health care, we're going to call it a government takeover because we've done focus groups, and that scares Americans. It makes them dread this. And it doesn't matter what the policy is. We'll call it a government takeover. And I came down here to the floor. At that point, my desk was much further over here around the corner. And I waved this around and said, is this what America's come to? Instead of working together to improve the healthcare system, instead, we're so polarized that the minority wants to stop us from improving healthcare, even if it makes sense. And they're going to make up a falsehood and sell it across America. Well, apparently that was what America had come to, because they did promote that falsehood all across America. Now, back home in Oregon, I'd made a commitment to go to a town hall in each of my 36 counties every year, open hour. People can come and share whatever they want. I'm out in Prineville, Oregon, where normally there'd be like 30 or 50 people at a town hall, and about 500 people show up. Why? Because they're terrified of a government takeover of the healthcare system. There's about 200 people inside the room. There's several hundred people outside who can't get in because the room's completely packed. And they are angry. They are very angry. And one man shouts out and says, why won't you listen to us and stop this government takeover? And I said, I'll listen to everybody in this room. I'll describe major features of the plan, and you all can respond to me, step forward or step backward. So I said, how about requiring insurance policies to cover pre-existing conditions? Step forward, 80% of the people in the room raised their hand. Step backwards, about 10%, another 10% didn't vote. I said, how about having preventive tests free because an ounce of prevention is worth a pound of cure? Step forward, 80%, yes. How about having children on your policy to age 26? 80% yes. How about having a website where you can compare private insurance policies so you can pick the best one for your family? 80% yes. Well, by now, people are looking around the room going, well, this all sounds pretty good, but of course they came and they were very angry. I said, well, let's talk about the economics of this. How about providing tax credits to help middle-class Americans buy insurance from private companies? 80% yes. People like that idea. How about expanding Medicaid? Because we have the least affluent in our society who are trapped between just a little too affluent to qualify for Medicaid, but they certainly can't afford private insurance. Oh no, that sounds good too. And so I would say then, thank you very much for the feedback on the major features of the plan. There's no government takeover in it. But you've all expressed to me your support for many of the features, and that's why I'm supporting it. Well, this was the year 2009. You had a blue trifecta that said, let's fill in the holes on health care. And we went about and did it. And now let's fast forward to 2025. You don't have a blue trifecta, you have a red trifecta. And the red trifecta knows how important health insurance is, so they made some promises. And the promises were, we will not touch your health care. We will not force people off insurance. And in fact, they did exactly the opposite. 2009, the House, the Senate, the Oval Office working together to fill in the holes and make sure everybody could get health care. 2025, the red trifecta of the Oval Office, the Republican leadership in the House, Senate, saying we're going to tear down your access to health care. And that's what they did in the one big, ugly betrayal of a bill voted a few weeks ago right here in this chamber, tearing down your health care. 15 million Americans going to lose access to health care because of this bill. Here's the philosophy we saw. Roll out the red carpet for the rich and powerful. Roll out the red tape for the less affluent. Wow. What a horrific strategy to rip health care away from 15 million people. What does that mean to a family when they lose health insurance? Well, I'll tell you, it means that they don't go to the doctor. And when they don't go to the doctor, that lump they ignored becomes ravaging breast cancer with horrific consequences for the woman, the family, the children. It means diabetes delayed is diabetes that is much more severe and hard to treat. It means all sorts of risks for the individual and all sorts of consequences for the family. And the stress of knowing you have a health care condition, you should go to a doctor, but you don't go because you can't afford to go. Or maybe you do buy a policy, but now it's more expensive. Here is what's going to happen on the healthcare exchange in Oregon. The cost is going to go up by 67%, an estimated $1,300 per family, because the big, ugly betrayal of a bill raised the cost of buying health care on the exchange because it didn't extend the premium tax credits that were in the bill previously, that were in the system previously. Well, that is a shocker, and if people spend the money there, it may well be that they don't have the money for their rent, may not have their money to purchase the prescription pills that the doctor they went to said they need to buy. Or maybe it's an impact on groceries. And I'll tell you what else happens. With so many people losing Medicaid in Oregon, the Oregon Health Plan, and in Oregon, the estimate is 150,000 to 200,000 people will lose Medicaid. Well, now, in your rural clinics and hospitals, we have a situation where the revenue that flows to that clinic or hospital drops dramatically. This is from the Sheps Center for Health Services Research and University of North Carolina, real experts on rural health care. And what do they say in this study? They say that more than 300 rural hospitals are at risk of either closing or significantly reducing their services because of the big, ugly betrayal of a bill. Oregon, 4 rural hospitals or clinics. Boy, almost every state listed here. Is that really what we want to do? We want to shut down rural health care? And when you shut down a clinic, when you shut down a rural hospital, you aren't just affecting the least affluent who were on the state's Medicaid plan. You're affecting everyone in the community. Every single person loses access to health care when the clinic or the hospital shuts down. You know, we lost 2 years ago a maternity care ward in Baker City, Oregon. Tragic for the community. If you are getting ready to have a child, now you're thinking about the fact to have it delivered, I have to go at least 70 miles down I-84, and I-84 is often closed in winter due to ice and snow. Is that the stress? We want to rip health care out of our rural community and put on the stress? And I'll tell you what else happens. People simply don't get down the road for the medical treatment that they should be accessing. So here's the story. This is wrong. So we're going to introduce a bill that reverses this and says everything that was ripped out of American health care by the big ugly betrayal of a bill, we're going to restore it, and we're going to add in the same tax credits people had access to last year. That way there won't be a 67% increase for people buying health care on the exchange in Oregon, a $1,300 increase. That way the middle class will still be able to afford to buy policies. And the less affluent will still have health insurance, so they will get the care they need. And the rural communities will still have the cash flow to be able to keep their clinics and hospitals open. That's the right vision, not the vision of families lose and billionaires win. That's the whole vision of the big ugly betrayal of a bill. No, but instead a better vision. And what is that better vision? Families thrive, and billionaires pay their fair share. Let's fight for that vision. Thank you, Mr. President.
Mr. President.
Senator from Maryland.
Thank you.